Okay, so today we're talking about what's the difference between dry needling and acupuncture. This is a really common question that I get asked a lot when I do talks, when I present to large groups of people. It inevitably comes up, the question of what is the difference between dry needling and acupuncture. So today we are going to answer that question and have a look about the difference between these two things. I'm Mary Hopkinson. I'm a Chinese medicine practitioner. I'm an acupuncturist and a Chinese herbalist. There's a photo of me on one of my latest trips to China. You can have a check out of me more and more at my website, retrohealth.com.au, so you can have a look about what I do. And let's get started. What's the difference between dry needling and acupuncture? Well, for a start, acupuncture is part of the system of Chinese medicine. So Chinese medicine encompasses all of these different treatment therapies, but it actually is all these different therapies are based on the same theories and principles and ideas. So what are those things, and what makes up a Chinese medicine practitioner? Well, they understand the theories of yin and yang. They look at the theory of the 5 elements, wood, fire, earth, metal, water. They understand the idea of the body in terms of qi, often translated as energy, blood, and Jing, or body fluids. They look at the body in terms of the organs. So what do our organs do in a functional sense? So not just a structural idea of, like, biomedicine's basically a structural system, but Chinese medicine essentially is a functional system. So it's by observation of what a person, how disease arises and how that person functions in a normal sense. So this is the traditional Chinese medicine principles and ways of understanding the body. Once we know how, this is basically the first year of Chinese medicine school in a 4-year kind of degree. So then we need to diagnose the problem. We need to understand how that disease happened. A Chinese medicine practitioner will look at their tongue. They will do the pulse diagnosis. They will use things like looking. That it might include the tongue, but it also looks at face diagnosis, observing, and these are all honed skills that are learned and practiced in the clinic. Then they may ask you quite a number of questions. People that come to a Chinese medicine practitioner may be astounded by the depth of questioning that's used in some cases to really understand the body. We use a thing called the 10 SMART questions, which is more about understanding the different aspects of, for instance, things like digestion and sleep and appetite and things like that. We also use palpation diagnosis, so this is looking at being able to palpate the channels or palpate the abdomen or different areas of the body to get more information about what's going on. That's all part of the theory. Then that's basically the first 1 year of Chinese medicine school. Then you need to learn how to do the needling. So a practitioner actually learns about where the points are, in the first case, so the location of the acupuncture points. And you may not realize that there's actually around 365 acupuncture points. We say one for every day of the year. There's actually a lot more than that, but that's a good amount to remember. The practitioners learn about 200 points on a regular basis they would use, and they do learn about every point. They would typically even know how to use and locate without a book or anything, 200 points. In addition to that, practitioners... go back to this one. So each point itself has an anatomical location. That means it has a place where it belongs on the body. Then practitioners need to know that. And then it also has around 3 to 5 functions, and it can also belong to different categories of points, and that tells you also what it indicates, what it might do. And then it has indications which can encompass up to around 30 different uses of all of these 400 or so points, all of which is expected to be learned and memorized by an acupuncture student. In addition to knowing the location, practitioners also have to be able to, and the functions of the points, practitioners have to learn how to use the points in combinations. So that's essentially called writing the prescription. The same principles of writing a prescription of herbal medicine are applied to writing the acupuncture prescription, which is why it's so it's individualized for each patient, and why it can be quite tricky and complex for each person. So once we know all that information, we have to actually practice it and become good at doing it. In the business world, we talk about the 10,000 hour rule, and this was populated by Malcolm Gladwell in his Outliers book, and it basically propagates that a person that practices something, even if they're not that great at it to begin with, if they practice it for 10,000 hours, they'll become an expert at it. So certainly, acupuncture, has had this in its understanding within Chinese medicine for quite some time, way before Malcolm Gladwell purported this idea. This idea that we need to continuously practice and practice the needling techniques using the acupuncture points to propagate a thing called finger force. Students are expected to basically practice their needling skills, and to demonstrate that, they would be able to needle through around 10 sheets of paper. Now, Chinese paper is a lot thinner than the 80 GSM paper. That's one way of demonstrating finger force. Another way of proving their demonstration in an aspect like in Twain-hour Chinese massage, we actually have a thing called rolling, which they would have to roll a bag of rice. I think this video is going to work there. There you go. So they would have to roll a bag of rice into flour to actually show that they can, demonstrate their rolling technique. So these are just different areas that we can see where Chinese medicine, encourages this honing of techniques. In addition to all of that, there's also various different styles of Chinese medicine. There's the understanding of the classics of Chinese medicine, and some practitioners go into quite a lot more detail about these different things. Really studying great practitioners and great people that have and sometimes even studying a particular style of Chinese medicine itself, and that would influence the kind of practice that you have, in your acupuncture or acupuncture and herbs practice. In addition to that, most practitioners in the West and in China these days would also practice according to the knowledge of Western medicine. So that's also 1 or 2 years worth of study. We learn anatomy, so we learn the Western medical concepts. A clinical application is a large part of many Chinese medicine programs. So we understand the musculoskeletal anatomy and in quite detail. Practitioners must be able to palpate and identify muscular issues, be able to palpate muscles to be able to find the points and identify those things, and also have a general understanding of pharmacology. So that means things like drugs, understanding the effects that they may have on the body, so we know what patients, although Chinese medicine practitioners aren't prescribing drugs, they need to know what those effects are for their patients that are taking various drugs. Understand the pathology of disease according to Western medicine. This is quite different to how we understand disease or disharmony in Chinese medicine. And then a lot of courses, especially from where I'm from in Australia, UK, the US, have quite a high expectation on students to understand research methods, the idea of scientific inquiry, to be able to look for evidence-based medicine, and to be able to show that acupuncture can be used in a evidence-based medicine aspects. And that can be used, evidence-based medicine can also incorporate, these kind of classical applications of acupuncture, but it could also be understanding research trials and modern applications of Chinese medicine. There's quite a lot of stuff, and this is all what we would call Chinese medicine. So if you're a Chinese medicine practitioner, you're expected to understand all of that. So whether you practice acupuncture or Chinese herbs or another branch of Chinese medicine, you need to understand all of these things. Once you understand how to diagnose the body and how disease or illness may arise, then you can use one of these branches to treat the patient. Now, an acupuncturist, and that's what we're really focusing on today, has a lot of different ways, and also a Chinese herbalist. We'll go there first. So one of the branches is Chinese herbal medicine. Another branch is Chinese diet therapy, so that's using foods in combination, usually with herbs, or understanding the properties of foods for prevention and treatment. We also have the third branch, which is Qigong, Tai Chi, exercise therapy, and Twain-hour or Chinese massage. The branch that we're focusing on right now is acupuncture, and it might surprise you that there's so many things within acupuncture that are not actually just your typical inserting of the needle. Once a practitioner has decided upon the diagnosis and the treatment principle. If they are an acupuncturist, there are lots of things at their disposal that they can use. Acupuncture includes the knowledge of cupping, so this is things like slide cupping, fire cupping, the suction pump cupping. It also includes the use of auricular acupuncture, so ear acupuncture. That's also the Chinese and the French style of acupuncture. And needling is also one of the things that is included. And moxibustion is another big part of acupuncture. This can be using moxibustion without needles, just using the stick like you can see here, or different kinds of moxa. And there's also moxibustion that's using on the needle head itself. Now within needling, there's a vast amount of needling techniques that are used. This is what we call the filiform needle. So this needle here has a handle and a shaft there, and you can see that the way the practitioner holds the needle is actually really important as to what's going on in the body. The most common way that we use an acupuncture needle is to stick it into the identified acupuncture point, and that will activate all the benefits of that point, like we talked about before, the local applications and also the functions of the point, as well as activate local circulation of blood. You can do things like release endorphins, which will have a pain relieving function, and that can generally occur if you stick a needle in any place that's got tight muscle tissue. You can also get this kind of endorphin releasing effect, which brings us to the discussion of dry needling. Now, within acupuncture, you also have all these different techniques or needle manipulations. In the Jing, it talks about all these different needling techniques. You've got distal needling, needling on the channels. You've got heat needling. That's using applications where you're applying heat to the needles. Now, a student of acupuncture will learn all of these different things, and then usually they'll choose to focus in on a couple of areas or one or two areas that they may use in their practice, and that can change from time to time. There's also the description of the 12 needlings in Chapter 7 of the Ling-Shu, and these are different kinds of things. So triple needling, for instance, is using 3 points into the one acupuncture point or area. Now, what's interesting is that the crack needling that's described in the Ling-Shu area, you can see this little circle overlapping, actually it probably most resembles the idea or the concept of dry needling. So dry needling uses techniques that are very similar to the crack needling described in the Ling-Shu, where Asher points, or these are particular painful points that are needled to relieve pain. So what will happen is you might go into a practitioner and you'll have pain in your neck or your back, and the practitioner will palpate that, just similar to like when you go to a massage therapist and they'll find like what we call trigger points. These points are actually also known to acupuncturists, and they may needle those points to release that pain or to treat that area. However, it'd be rare for an acupuncturist just to needle those trigger points alone and just leave it at that. So to palpate the area and only needle those points, and then that's all that you get. Dry needling alone is a technique based on needling those painful points with knowledge of the musculoskeletal anatomy. Dry needling doesn't require any knowledge of Chinese medicine to be done. So it doesn't require us to know about the yin-yang and the 5 elements or the other theories that we discussed earlier. Actually, when done by a practitioner who isn't a Chinese medicine practitioner, dry needling really fits over here. Perhaps one way to define dry needling is the application of the Chinese medicine concept of Asher point needling without any Chinese medicine assessment or training at all. Chinese medicine practitioners can perform dry needling. That's something to consider, something to note. Chinese medicine practitioners have the ability to view the body and understand the body in health and disease from that Western biomedical point of view and a musculoskeletal point of view. But they can also view it in that parallel Chinese medicine way. The techniques used by dry needlers that is, those Usher point needling techniques, are applied to trigger points and with only the musculoskeletal framework. They're taken from Chinese medicine, but they were never intended from a Chinese medicine standpoint to be just used as the sole treatment, even when an acupuncturist treats main complaints. So really, Chinese medicine, really dry needling fits out over here, and it's nothing to do with Chinese medicine. So please, don't confuse dry needling with acupuncture. When we just do dry needling, we're actually missing one key component of Chinese medicine which all practitioners would take into account, which is the prevention treatments and the ongoing treatments. Practitioners offer diet and lifestyle advice for longevity, illness prevention, based on the patient's constitution and circumstances. That can be treatments that they might do, so additional acupuncture points that are used to help promote more energy and blood production. Sometimes patients I see have long-standing health problems, long-standing neck or back pains or things that recur. Just needling those local points sometimes isn't enough to really get down to the nitty-gritty of the problem, and the pain will just basically keep on coming back. Chinese medicine is so focused on prevention. You know, in some eras of Chinese medicine practice, if the patients got sick with colds and flus and they were under that care of the doctor, it was seen that the doctor didn't keep them healthy and they wouldn't even have to pay for their treatment. That's something that Chinese medicine practitioners understand. So in summary, let's just look at the facts about the difference between dry needling and acupuncture. Firstly, non-Chinese medicine practitioners who offer dry needling, they're not performing acupuncture. They're using one technique found within acupuncture, that's what we would call Usher point needling, and applying it in a completely musculoskeletal understanding of the body. Secondly, dry needling originated with the use of an empty hypodermic needle, actually not an acupuncture needle at all. And it was only through the practice of using dry needling with a hypodermic needle that they found it to be too painful for patients to endure, so they opted to use the more comfortable acupuncture needle. Thirdly, when an acupuncturist gives you dry needling, although a person saying they're a dry needler or a person practicing dry needling can't give you acupuncture unless they're a trained or registered acupuncturist. So an acupuncturist can give you dry needling, but a dry needler cannot give you acupuncture. Western medicine concepts and their clinical application are a large part of Chinese medicine training programs in the West. Acupuncturists are able to palpate and identify muscular issues, and they can treat patients according to the musculoskeletal framework alone. If that's what you want, you need to make that clear to your practitioner, and they're well equipped to be able to do that. However, they usually choose to diagnose according to Chinese medicine, which is a system that runs parallel to Western medicine understanding of the body. For musculoskeletal conditions, patients of an acupuncturist will get the best of both worlds approach, whilst a dry needler can only give you a treatment according to your body with Western medicine. The fourth one is that dry needlers typically have not honed the needle insertion technique. This is going back to my idea of the 10,000 hour rule. Although this is a generalization, it might be worth asking your practitioner who's going to perform dry needling on you, how many hours have you spent practicing needle insertion? After all, dry needling has developed to use an acupuncture needle, which requires honing of the skill and training by practitioners to practice over several years before they're considered good enough to treat patients by themselves. Acupuncturists are trained to develop what's known as the finger force. That's the improvement of a practitioner's finger force, which enables the acupuncturist to insert the needles into the tissue whilst releasing the tight tissue without too much pain. If we go back to the 10,000 hour rule, which is practiced by Chinese medicine practitioners, and as a teacher, I know this is something that I make really clear with my students, the honing of the techniques. The continuous practice of developing the finger force is something that's really important for practitioners to learn. If you're going to get a needle stuck into you, who would you rather sticking that needle in? A person who's had hours and hours of practice, or a person who's had a weekend course, a few hours of training, even half a year of training? How does that compare to a Chinese medicine practitioner? So next time you're faced with the question of getting dry needling, you want to ask yourself, who is my practitioner who's doing it? And please don't confuse acupuncture with dry needling. If you have any more questions, you're most welcome to email me or send me a comment on my social media. You can contact me through my website, metrohealth.com.au. I'm Marie Hopkinson, and this is my talk on acupuncture and dry needling. I hope you've enjoyed the presentation. Thank you.